All right, thanks for joining us, everybody. Just to introduce myself here up front, my name is Andy DeGraw. I'm the Chief Operations Officer with the school district. And we're here today to talk about health insurance premiums, and we'll give some other information, upcoming important dates and things to be aware of as we get closer to open enrollment. Also with me today, we have Kathy Port, our Assistant Director of Human Resources, and Teresa Paulson from our Benefits Department. They're with us as well. We're going to go through some stuff. We'll wade into some numbers here. I know most folks aren't, I guess some of us are numbers people, some of us aren't. And so you might have lots of questions. We're going to be taking questions, and after I get done with my presentation, we'll get to as many questions as we can. My intent is for this meeting to not go any more than 30 minutes. And so we'll get to as many questions as we can. But if there's questions that don't get answered, don't worry, get them into the chat, put them into the chat, and then after the fact, we'll circle back around and possibly put together an FAQ responding to questions that we weren't able to address here in the Zoom. So, and just as a FYI, this meeting is being recorded. So those of our staff who aren't able to be with us at this time due to their work continuing on later, this will be available for folks to reference after today. So we'll go ahead and get started. Some key dates and things to be aware of. Our open enrollment is going to be October 15th to November 15th. And there we'll have employees will have the opportunity to meet with representatives from American Fidelity. In addition to those meetings during open enrollment, on October 1st at the in-service, American Fidelity representatives will be presenting to both groups, both FEA members as well as ESSA support staff. I believe the certified staff they'll be meeting with at Lathrop, and then at West Valley for the support staff. They will be making presentations there. So we know information is power, and it increases the ability to make good decisions. And so we're going to be coordinating extensively with union leadership to get as much information out as possible. Blasting out announcements on social media, by email, different newsletters, any way we can to get the message out as early and often as we can. We know sometimes emails are missed or newsletters aren't read completely. So our intent is to get a lot of information out so things aren't missed, and also provide a high quantity of quality information to help people make good decisions. And so if you ever have questions, feel free to reach out to our benefits department. They're eager to help folks know where to go to provide good information to be able to make those good decisions. Benefits, as everybody is probably aware, is becoming a bigger percentage of compensation packages with increasing costs. And so it's important to, as those costs go up, to make sure that we are utilizing those benefits as best we can. So that's certainly our intent. I'm going to go over, the first thing I'm going to go over is our rate sheet I'm going to go over 2022 premiums that are going to begin on January 1 of 2022. I'm going to share one screen initially, and then I'm going to share a second screen with you guys. The first screen, let's see if this works. Bear with me. All right, can folks see that? Is that Kathy or Teresa? Can you guys? Yes, okay. This is the rate sheet, and this is I'm going to highlight a few of these numbers here. first going to explain how we arrive at our rates. And then after this sheet's a little bit confusing. I recognize that. And so I'm going to share a second screen subsequent to this one to hopefully make things look a little clearer, more simple. So what we have, and Kathy, is my cursor visible on the screen? Okay, good, thank you. So the way, and this is in our negotiated agreement that was bargained 2.5 years ago. This premium calculation methodology was bargained 5.5 years ago, and is now just going into effect now this upcoming year. So the way the premiums are arrived at is we have 100% rate for each plan. My cursor here, this is the 2021 rate that was established last year. And these are the numbers for Plan A, for example. 100% of the rate, the cost of an employee only plan was $26.24. For employee plus spouse or children, $34.98. Employee family plan, $43.73. These are for Plan B and C as well. These are the 100% rate. So it's the total cost for an employee only plan. For Plan B was $756 per month. These are monthly figures. And for Plan C, $1,220 per month. That's the total cost. And what we did, so we took that rate from last year. Then we coordinated with our health plan consultant, and we came up with the 2022 rates for the upcoming year. And the difference between the 2022 rate and the 2021 rate becomes the monthly premium for employees, okay? And so just to follow my cursor here, again, I'm gonna simplify this down in just a minute, but we have the 2022 anticipated cost for Plan A is $31.27. I'm circling it, that's the upcoming year projection. Last year's was $26.24. So that means the 2022 premium per month for a single Plan A is $503 right here. And the per pay period, so you take that annual amount and divide it by 19 pay periods, which is how we function, that would be $318 per paycheck, okay? And you can see the same methodology applies in each plan for each category, single, employee plus one, or family. So for Plan B, for example, last year, the single rate was $756. This upcoming year, it's projected at $785. And so the difference between that is $29 per month, which when divided by 19 pay periods, it's $18 per pay period, okay? DVA, now this is a different, I'm not going to get into how we calculated premiums in the past, but this is a new way of calculating. DVA did not change. We've always taken the total DVA cost and we've done an 80-20 split on that. So the district picked up 80% and the employees picked up 20%, and that methodology stays the same. And so the DVA rates are found for all plans. This isn't plan specific, it's for all plans. Per monthly dollars, monthly amounts right here, and then per paycheck amounts down here. So one thing that will jump out is the projected costs for Plan C into next year, 2022, were actually slightly lower than the projected cost last year. So Plan C premiums are still $0. There can't be a negative. Zero is the lowest that there can be. So those are at 0. And just to simplify this, again, like I said, this sheet's a little bit daunting. I'm going to jump to another, well, you might already see it. Do you see that? Kathy, is that, I just put a new graphic on the screen. So this simplifies it a little bit more. So I'll go through this one more time so people can hopefully better understand it. We took the 2021 rate, the rate for last year, and again, these are monthly amounts, the 2022 rate that we're projecting for the next calendar year, and the difference between the projection for this year and the rate for last year is this monthly amount right here. And then this last column here is the per pay period amount. Show that illustration for Plan B as well. Last year's rate, this year's rate, and then the difference between those two is the monthly amount, and then per pay period breakdowns in that last column. And these are all items that we can share as well outside of this Zoom meeting. And then Plan C, pretty straightforward. The difference there ended up being negative, but again, we can't go below 0. So the premium rates for Plan C for 2022 remain at 0. A couple of things I wanted to note, and then we can get to questions that have possibly been sent in. One thing, just some by way of information, as we get closer to open enrollment, as you have questions, and obviously we recognize the costs for Plan A have gone up significantly. The premiums, the projected premiums are based on the claims experience in each plan. And it just so happens to be that, unfortunately, the claims that have been incurred in Plan A are significantly higher than the other plans. And that's why you see the higher premium rates. I imagine there will be, because of that increase that we recognize, I foresee a significant interest possibly in looking at other plans. And so there will be a process during open enrollment that people will be able to meet with somebody who can help make that decision. We definitely shy away from telling people here that go to this plan or go to that plan, but they'll be able to answer questions. Obviously, one of the big questions is cost, and those costs are it's relatively simple for somebody to help you understand what the costs are. One thing that people often say when the question gets posed, why with costs going up significantly in Plan A, what are the reasons why folks would stick with Plan A? One of them we know is there is a perception out there that the quality of care might be better in one plan or the other. Like, well, Plan A is what I know, and I've heard that there's better care in Plan A, and that's just here to say that certainly is not the case. The quality of care, the care that can be accessed, is exactly identical in any plan. The only thing different between the plans are deductible and max out-of-pocket numbers, premium numbers, costs, and then there are differences in accessibility, for example, to the CHC. So Plan B does not have access to co-pays. I think is it a $10 copay that we have with the CHC? Plan B, unfortunately, doesn't have that access, but Plan A and Plan C does have access to the $10 copays. Prescriptions, there's prescription copay availability as well on Plan A and C, but not on Plan B. In Plan B, prescription costs come straight out of your pocket and they go towards the deductible. A benefit of Plan B, however, is you have the opportunity to set up an HSA account, which is a tax-deferred, tax-sheltered, tax-free account where people can route income. They route paycheck dollars into that HSA account. It becomes tax-free. And then they can use those dollars to pay medical expenses. That account is completely portable. You can take it with you. It's perpetual. If you don't use funds in any given year, those stay. It's not a use it or lose it account. So funds don't expire. And then at age 65, there's the ability for that account to transfer and to morph into literally an IRA retirement account. After the age of 65, you can use those dollars for other things other than medical expenses without penalty. So there's benefits, there's pros and cons to each plan, and it certainly would depend on someone's specific situation and circumstances, what plan might be better or not better for them and their family. So yeah, just remember the quality of care is not different from plan to plan. Same access to networks and coverages across all plans. And you know, the other big thing to consider again is what I just mentioned, the features and the benefits of each plan. And folks from American Fidelity, when you meet with them at open enrollment, can help walk you through the different considerations to help you know what's best for each one of you. Right now we'll go to Teresa. Are there any questions that, and if there's any question, I'll do the best I can answering questions on the fly. If there's something that stumps me, we'll certainly get back to the group and send out communications answering any question that I might not be able to answer on the fly. So.
Yeah, someone asked about the difference in the plans A, B, and C, but you started in on that right after.
Yeah, and Kathy, along those lines, can you give information on when for this year will be available? If not, and that provides a lot of the general numbers and some general information that people can go through to help understand the differences and similarities of the plans.
So we should have that by next week. However, the similarities in the plan are still the same. So that document that Andy is showing is on the district website. Teresa, can you put the link in the chat box so people can see last year's open enrollment, and you can go on specific pages and look at the difference between plans A, B, and C. You're going to see a difference this year in the costs, as Andy already talked about, but that updated guide we're hoping to have by the end of next week. As soon as we get it, we will be letting people know that it's there.
Yep, great point, Kathy. If you have this one from this year, from 2021, it's the Employee Benefits Enrollment Guide. So the features of the different plans are the same. So you can reference the current one before they get the new one out to us for 2022. Access that document, and you'll be able to see the differences in the plans and what they offer and whatnot.
So there's a question from Laura about Plan A rates. We can't determine what they're going to go up, but healthcare costs are going up each year. So if you're looking at a trend, you would say that things would be going up. And Laura, once you opt out of Plan A, you can no longer go back to Plan A. Once you opt out of Plan A, the only choices you have are Plan B, Plan C, or to waive coverage. There's a question here about Plan C. All of our plans cover dependents up to age 26.
I saw a question about our copay is going to change, and I believe the answer is no. Those copays will stay the same for 2022. One thing I want to just throw out there anecdotally, again, we stay out of the habit of telling folks, hey, go to this plan or go to that plan. We're here just to provide information. If someone were to just strictly go off the numbers, Plan A is going to be pretty much regardless of your health circumstances. So you could, whether you're the healthiest person on earth, you're running marathons 2 or 3 times a year, you're just healthy as a horse, all the way to, unfortunately, you have some significant health costs in your family and circumstances that, lots of doctor visits or challenges, prescriptions, that whole range, that whole spectrum of circumstances, 99.9% of those circumstances, you're going to find significantly lower costs in Plan B or C than you will in Plan A. Again, regardless of your circumstances. Cost isn't the only consideration, but if you're looking at it from a strictly cost perspective, the deductibles, the maximum out of pockets, And then in addition, you have to, when you're looking at total costs, you throw in those premium costs every month or every paycheck for 19 paychecks. You take all those three factors into consideration. You're going to be hard pressed to find a situation where plan A is lower cost than plans B or C. And again, sometimes folks have a concern of, the other plans, B and C, are higher deductibles. So you might have to come up with more out of your pocket all at one time if you have, an emergency room visit or an operation or something of that nature. Oftentimes what people do is instead of having dollars taken out of their paycheck for plan A, for example, they instead take those dollars or even a lower dollar amount and reroute them straight over to an HSA account or a flexible savings account that somebody can utilize in plan C, I believe, or set them aside in your own savings account for that matter. Reroute those dollars that would have otherwise gone to pay for premiums, route them to yourself and use those to pay the medical costs that you might know are gonna, you might know, hey, we have this procedure coming up in November, and so oftentimes people look at it that way. They're worried about having to come up with large amounts of money all at once. And so again, a strategy that many people have used when they make the transition from A to B or C is they just keep taking the dollars out of their account. Instead of paying it to premiums, they're paying it to themselves, getting some tax breaks. And if maybe you have had some medical costs in the past, but you're not sure, maybe this is going to be a good year. So maybe it's a better option to, instead of, if you pay the dollars to premiums, you're not getting it back, right? But if you pay it to yourself and maybe you have a good year and your costs are extremely low for that year, then you've paid yourself and you have those dollars in your account to where you can use them instead of just paying them to premiums where you're never going to get those dollars back. So just one of the considerations from a cost perspective that people look at when they make that transition. Other questions that we've received?
Did you do the plan covers young adults 21 to 26 still? Yes.
Yeah, we got that.
The payments aren't going to change. Someone said they thought when plan C came out, people on plan A would be able to go back if they didn't like C.
We covered that.
And that was it. Yeah.
Okay.
Sorry, I was looking for that document online.
Yeah.
All
right. Well, again, as we get closer and closer to open enrollment, we just encourage everybody to access that enrollment guide that we have. Again, for last year, you can access it now or next week. Sounds like towards the end of next week, we'll have it available with 2022 numbers. And the partnership with American Fidelity has been beneficial. They're there to help. We, our superhero team of benefits folks is like 3 people, and trying to help, upwards of 1,500 to 2,000 employees with questions that it can be a daunting task. Our partnership with American Fidelity has allowed us to have more of an army, approach. They have a whole slew of folks that can meet with people, and we can hopefully better meet the needs of staff, answer questions. And again, like I mentioned, our intent is to get folks as much information as they can to help make them good decisions. Because, obviously health insurance, those costs continue to go up, and we want to make sure that people, maximize those precious dollars the best they can. So thank you, everybody. Again, if you have any questions, feel free to reach out to us.
There's a couple more questions that just came up. The person just wanted you to reiterate about the 21 to 26 coverage.
Yes. So in all 3 of our plans, dependents up to age of 26 are indeed covered.
Okay.
And then in person, American Fidelity, There's going to be a couple opportunities. So they will be here. They'll have representatives here in person on October 1st. They'll be presenting at both in-service days, both at West Valley and at Lathrop. And then I'm not sure, they very well could be doing Zoom meetings
also
for open
doing
enrollment.
Zooms.
Is that accurate?
Yeah.
Yeah. So they will be by Zoom. But they will be in a small number of them will be here in person for those in-service days. So there would be an opportunity to possibly visit with them there.
Also, we
All
can
right.
mention that this is being recorded and we're going to put it on the Human Resources website probably sometime tomorrow. So if you know of anyone who had questions and missed this webinar, they'll be able to watch it on, the link will be posted on the Human Resources website sometime tomorrow.
All right. Thank you, everybody, for participating. Have a great day.